Today on Cancer Buzz, how cancer care teams can support caregivers during the pandemic. Caregivers are an essential part of the patient support system, and COVID-19 has changed their role significantly as they try to care for their loved ones. Cancer care providers can be a valuable source of guidance and resources for the friends, family, and loved ones of patients with cancer. Dr. Lawrence Wagman is a surgical oncologist and medical director at City of Hope National Medical Center in California. Dr. Wagman, how can we best help caregivers across the board? And then what's your advice for supporting our caregivers during a pandemic?
I think functionally speaking now with COVID, where we have dual obligations, obligation one is to care for the patient, and obligation two is to protect other patients and the healthcare providers so that there will be a staff to do that. Means that we just have to be more open to simple ways of communicating. So maybe it's a quick call, leave a message, and we'll get back to you with some known parameters of time. Or email, anything that can be done in kind of a short order. And I also think there's an education to the people who are asking the questions and answering them, that everything be very short. The longer a question is, the harder it is to interpret what the question actually was. So can I get up 3 times a day or only 2? There's a quick answer to that. I notice this part is much more swollen, and what to do for that. The other things that have kind of been helpful, and there are a lot of things I think in the past that we would just say, well, just come on in, we'll take a look at it. Now we can say, take a picture of it and send it in, and we'll get right back to you.
Caregiving for a loved one, a family member, or a friend going through cancer is hard without a widespread pandemic. How is the pandemic adding to that challenge or burden of caring for their loved one? There's virtual school, there's keeping family members away from each other.
So my major experience is the separation of the caregiver as part of the care team from the direct interaction with the patient. So for the face-to-face visits, the management of that is very challenging. I think sometimes when we talk about caregivers, we have specific tasks. So I will give you the surgical, taking care of drains or bandages on the incisions. We call that person the caregiver who are helping with those things. And now they get their education either virtually or reading off a piece of paper, but not that kind of direct hands-on watching what goes on, at least not as easily done because of the separation.
Are they able to attend telehealth appointments with the patient? How's that working?
The telephone as a communication device is still excellent. What many, if not most places, do not have is a visual 3-way conversation, so that it's the care provider, the healthcare provider, and the patient all visualizing each other at the same time. And there's a lot that can be written down. There's a lot that can be done in boilerplate or prepared presentations. But let's face it, and we're all accepting it now, that medicine is precision. The patient is a patient of one when you're actually dealing with them. So one person's needs may be slightly different, and it's easier for them to get out of the bed on the right side because that's where their bedstand is. And if the care provider is there at the same time, the conversation would be helping the patient get out of bed and walking. That would be a very important feature, as opposed to a generic explanation of what to do.
What have you been telling your caregivers how to take care of themselves during this health emergency?
The first thing to do is recognize that there is a problem, whether it's a normal day or an abnormal day, that there's a lot of anxiety being the caregiver, and that the caregiver shouldn't feel bad about that, and that the healthcare provider team is there to help them walk through it. Once they know that everybody is worried, they feel less worried. I mean, there'll be a few people who will still be outstanding, but for the majority of people, just the knowledge that this is an anticipated problem or a concern really eases them.
You can check out the show notes for more resources on supporting caregivers. Next time on Cancer Buzz, we look at how telehealth policy is evolving in the wake of the COVID-19 pandemic. Subscribe to Cancer Buzz wherever you get your podcasts to get that episode delivered right to you. For the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.